we live in a very high-risk area here, so starting from the very youngest age of my patients, whether they're just even a couple months old, up through any of the older geriatric patients, we are all looking for sun exposure causing problems and what the potentials are. Some new studies have come out recently that show that from 3 months to 3 years old is the highest risk if a child gets a sunburn for developing skin cancer later on. So I'm very specific with a lot of my infants and young children with my parents about making sure that they are using appropriate means to keep from any excessive sun exposure to the children. Now, I say that in the light of also we have a problem now too where some populations have become so fearful of the sun that we have vitamin D troubles, because the sun is actually one of our major sources of gaining vitamin D from the transition in our skin. So I tell them, I say, I want them having a little bit of sun, and even inside, in front of a window, playing in front of a window, things like that, to get some of the vitamin D benefits for short periods. In and out of the house is usually not where I'm seeing the biggest problem. It's more the beach time, the pool time, the soccer field or sport field time. I said from that is where we really need to be aggressive on our young people, our middle-aged people, and our old people about keeping the sunblock on, or the boat time in this area is very high. So that's where I'm telling them to be very aggressive with hats, cotton shirts. The new swimwear that's out is actually very recommended, especially for the children, which has long sleeves and doesn't give them that option that, oops, we forgot, they got a bad sunburn, and increasing their risk long term.